So maybe you've asked yourself this question. Is there a better way? Could there be a better way? This was a question that my guest today, Dr. DeWitt Wilkerson, asked himself over 10 years ago. And yes, you heard me right. The Dr. DeWitt Wilkerson is joining us on the Business of Happiness podcast. The same man who joined Dr. Pete Dawson over 30 years ago in practice and has been influencing and teaching over 40,000 dentists in occlusion, restorative dentistry, and TMD. Literally at the height of his career, decided to make a left turn and put his focus on something completely different, groundbreaking, way out there. And yes, that is what we're talking about today. You are going to be fascinated in Dr. Wilkerson's journey and hear how his greatest influence was his mom. Yes, a woman born in the 1920s, and how she influenced this significant change in his career path. We're also going to find out how integrative dental medicine has impacted his life and what that means to him, and why he thinks dentistry is the most important specialty in medicine. This is a great one. I am so excited for you to hear this episode today and to learn a little bit about the man behind this incredible story. Join me in welcoming Dr. Witt Wilkerson. Hello, and welcome back to the Business of Happiness podcast. Today, I am so excited to be sharing with you a very exciting new friend of mine, Dr. Witt Wilkerson, and I'm just so eager to be sharing this great information with you today. We've met a couple of times, and I'm just so excited about his journey and really eager to be sharing some of these new ideas that he has about understanding dentistry differently. And I think just today is going to be a phenomenal, phenomenal day. So welcome back. I'm your host, Dr. Taryn McCarthy, and join me, please, now in welcoming Dr. Witt Wilkerson. Welcome.
Oh, thank you, Taryn. It's great to be with you. And thank you for what you're doing to make our lives so much better and more enriched. It's just a wonderful thing to watch somebody that is having such a great impact and to get to know you better.
Well, I think we're on a very similar journey here. We both have very similar intentions in different directions, but I think that's why we connected so easily.
Yeah, for sure. And well, there's a lot of overlap, obviously, and things that make us happy and enrich our lives and give it meaning. So
absolutely. And that's the whole point. So I'd love to start with just a little bit of your story, your personal story and the journey for my audience who don't know you, which I can't believe there's someone out there who hasn't heard of you. But if just in case someone hasn't, share a little bit about your journey from the beginning and how you got to where you are today.
Okay. Well, the beginning really starts with my mom, who my mother, Dottie, was raised in rural Burgaw, North Carolina, which is as small as it sounds. The whole county had about 2,000. It's near Wilmington, near the coastline. And she was raised in a family where her mother and her 5 sisters, her aunts, were all obese and had cardiovascular problems, of course, diabetes, died in their 50s and 60s. And my mom, even as a teenager, I think thought, I don't want to end up like that. And so born in the 1920s, she determined to pursue health when nobody was really talking about that. So I remember as a young boy going to the health food store with her and the funny smells that would be in the health food store and the different vitamins and supplements and different things that she would buy. We grew up in a home where we didn't eat sugar. We didn't eat white bread. We had powdered milk instead of whole cow's milk. Whatever the nutritionists at the time were saying, she would follow it exactly. She would jog every day and exercise and get on the scales every day to check her weight. And she was about 5'6" and weighed maybe 125. If she got up to 130, buddy, she went on a fast for a couple of days and never varied from that. Well, make a long story short, I can recall her juicing carrots, for example, in juicers and drinking carrot juice until her hands and feet would turn orange. And if we got a sniffle, she'd chase us around the house and give us B12 shots in the bottom to prevent us from getting colds, things like that.
She
So,
was so way ahead of her
yeah.
time.
And the end of the story is she just passed away in January at 100 plus 3 months. And she was well to the very end, never had cardiovascular disease, never had diabetes, never had any issues with health at all. In fact, she fell and broke her hip about 4 years ago. And she said, this is the first time I've been in the hospital since you were born.
Wow.
And so Dr. Ken Cooper, who started the Cooper Clinic in Dallas, is a very renowned, he is known as the father of aerobics and the connection between exercise and health along with nutrition. And he describes it in like a curve where if you look at one axis vertically, that would be your health. And then along the horizontal would be your age. And he said most people, and I may be doing this backwards from looking at you, but most people during their lifetime kind of go down, 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 and then die unhealthy after having various procedures and medications and nursing home and this sort of thing. But he said, as he's worked with people at the Cooper Clinic in Dallas that have been very committed to health, he's found that those that will exercise and eat healthy and maintain a healthy weight and all the things that we know are important lifestyle can stay healthy, 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 and then at the very end, decline very quickly. And he calls that squaring off the curve. And so if there was ever a role model for that, it was my mom. She squared off the curve. She lived independently till she was 99, cognitively was sharp as a tack until maybe 6 months before she passed away, and basically just got tired where she wasn't hungry, was how she faded out. So that was the background. Then I was unbelievably blessed to be asked to join the practice of Dr. Pete Dawson in 1982 when I graduated from dental school at the University of Florida. We live in St. Petersburg. And Pete was a family friend. I didn't even know he was a dentist, much less probably the most famous dentist on the planet. And so he invited me to join his practice. And, the standards obviously were incredibly high. And he was teaching all over the world and to dentists everywhere. And so within about 4 or 5 years, I was able to start teaching beside Pete and under Pete's tutelage. And we've had now at the Dawson Academy, which is here, and you see the statement behind me, I'm in the Dawson Academy facility right now, which is right above my office. We've trained about 40,000 dentists over the last 30 years in hands-on courses and workshops and seminars. So we know dentistry very well. We know the challenges that dentists have and the things that they're concerned about and that bring them stress and anxiety and lack of fulfillment or joy and fulfillment in their work. And we take a very philosophical approach to what we do, much like Dr. L.D. Pankey did, who I was fortunate to also know, where it's all about balance. It's all about understanding, the purpose of our life and that we have significance in being on this earth and the ability to contribute to mankind and do things that really give us not only the monetary reward of success, but also the spiritual reward of significance in what we do. As I've been with Dr. Dawson since 1982, we've gone through a bunch of frontiers in dentistry. From, I remember 1982, we took out a lot of teeth. We were doing a lot of partial dentures and these sorts of things. And of course, since that time, perio has become tremendous in our ability to maintain teeth for a lifetime, implant dentistry, aesthetic dentistry, digital dentistry. I mean, just one frontier after the next has happened.
Infection control was in there too. That was a big one in the beginning.
As we've watched this, it's just been remarkable where things have progressed.
Yeah.
Well, about 10 years ago, he and I were having a conversation, and the conversation went to, what do you think's next? What would be the next frontier in dentistry? I mean, we've really, we understand occlusion, we understand aesthetics, we understand function, we understand perio, we can replace teeth in a wonderful way. So where do we go from here? And he actually challenged me to consider that and go find the answer. And in 2012, I was invited to go to the second ever meeting of a new group that was called the American Academy for Oral Systemic Health, AOSH. And they were meeting at the Cleveland Clinic. And the speakers there were the researchers at the Cleveland Clinic Wellness Institute, headed up by Dr. Michael Roizen, who is often a guest on the Dr. Oz show and has written a bunch of books with him and very prominent. And as they were speaking, there was a theme. And the theme, whether they were researching diabetes or Alzheimer's or cardiovascular disease, the theme was inflammation. Inflammation was the key. And they all understood that it was all about inflammation out of control that affected all these things. And in fact, that they were all linked, that whatever you manifest in what we would call now Western diseases, predominantly, are related to the same issues of cellular inflammation, and the cells just don't know where they live, or what they're part of. So it could be anywhere or everywhere. And we see that now, don't we? And so at the end of that weekend, Dr. Michael Roizen stood up and he said, we have a healthcare crisis that is destroying our nation. And it's not only going to destroy us economically because it's unaffordable to take care of everyone that's so sick, but it's also going just to destroy our health in general. And he said, so we've got two options. And I'm literally quoting what he said because it impacted me that significantly 11 years ago. He said, we've got two options. We can ration healthcare and put a limit on your accessibility to healthcare, like high deductibles and pre-existing conditions and all these things. And he says, we'll have to do that because it will bankrupt the country. He said, the other option, though, is that we can become rational, and that is where each one of us takes personal responsibility for our own health. And we're not dependent on our doctors to keep us healthy, but we take on that responsibility ourselves. He said the problem is that people often don't know how, and the healthcare system doesn't really support them. He went on to say the average physician spends 10 minutes every 2 years with their patients. What's your chief complaint? I've got chest congestion. We'll get a chest x-ray. Oh, you have walking pneumonia. Here's an antibiotic prescription, and you're on your way. Well, how did you get there? And why did you develop pneumonia? And what's going on, there? And so I would compare it personally now to saying, so we look in somebody's mouth, Taryn, and they've got inflamed gingival tissues, just beginning, periodontal disease. And as what I would call physicians of the masticatory system, or oral physicians, then I would hope we would say, once we begin to have our eyes opened, there's a lot of inflammation there. I wonder what's going on in the rest of the body. Isn't that just a reflection of what's probably going on everywhere? No different than if you took an ultrasound of the carotid artery and said, there's plaque in that artery. Well, guess where else there's plaque? Everywhere, everywhere. Right. That's almost the last place that you're going to see it. And so with that, Dr. Roizen said to us in the audience, which were dentists and hygienists, he said, I want to challenge you as dental professionals that you have stronger relationships with your patients than anybody else in the medical field. You have patients that are committed to coming in regularly. You've trained them, that they should come in twice a year at least and see the hygienist and have their cleaning and have their x-rays and have an examination, and they'll do that for the most part. He said, I want to challenge you to be on the front lines fighting this healthcare crisis that's destroying our nation, because I believe you can become the greatest specialty in all of medicine. And literally, Taryn, when he said that, it was like a calling. I mean, I just knew that's the next frontier. And that's what I need to spend the rest of my career learning, and then trying to share with others, because I'd been privileged to be gifted with a platform as an educator, with the opportunity to speak a lot and widely. And so how could we use that to, the advantage of everyone? And so I've spent the last 11 years trying to learn everything I can about medicine, with the question being, where do we fit in? So I've gone to Alzheimer's meetings in Las Vegas where there were 250 physicians and me. And I've gone to cardiology meetings where there were cardiovascular surgeons and cardiologists and one dentist, and diabetes. But the question would always be, is there a role for us here that maybe no one's thinking about? And very often there is. So out of that has come just gradually developing not only understanding, but strategy. And they call, as we're all familiar, physicians that are looking at the whole person and not just the symptoms. They call that integrative medicine, or sometimes functional medicine. And so there's a whole group that are sort of breaking away that are calling themselves integrative physicians. And those are often your concierge physicians who want to do things differently and not be controlled by insurance. So what we've done is we've taken that idea of integrative medicine and I've inserted dental. So it's integrative dental medicine, or IDM. And then the next challenge was, how do you create a model that doesn't scare everybody? So that we in dentistry go, so does that mean I have to go back to medical school? I mean, this sounds kind of, overwhelming, that you're talking about all these different whole health factors that we've never really learned. The truth is, many of our medical colleagues really haven't that much either. So in trying to simplify, which is something Dr. Dawson really did masterfully, I came up with 3 pillars, as we call it, for integrative dental medicine. And that is, these are the least common denominators. And if we can just focus on these, then we can do a great job of having a great and meaningful role in medicine. And the 3 pillars are inflammation and infection, locally and systemically. And we're all familiar with oral systemic connection. Well, there really is oral systemic and systemic oral connection that we can learn about. And so we all know that periodontal disease can exacerbate diabetes, and diabetes can exacerbate periodontal disease. But how many of us are even looking or thinking about diabetes? But if we were a physician that was an ophthalmologist, would we be interested in whether our patient has diabetes? And the answer would be, well, of course, because you can go blind from diabetes. Well, why would it be different for us saying, well, of course, we're interested in diabetes. You can lose your teeth because of diabetes. And so those are the things we're looking at in that 1 pillar, is inflammation and infection. And in expanding this, we've formed a group now that we're calling IDM Scholar Society. So this is a collaboration of dentists and hygienists and physicians and nurses, where we're learning together about these things. And so we've put together a teaching team. One is Laura Hooper, who's a tremendous researcher, a dental hygienist, I call it periodontal therapist, who has probably used every product and system and testing method ever developed. So she's teaching with us. And then Dr. Gina Pritchard, who's in Dallas, Texas, and she outside of Dallas, and she's a nurse practitioner with a doctorate in cardiovascular risk. So she's worked closely with Dr. Brad Bale and Dr. Amy Doneen, who wrote the book Beat the Heart Attack Gene, and have spoken at a lot of dental meetings and are just brilliant. And their whole focus is on inflammation. In fact, Dr. Bale says that if we can look at all the inflammatory markers that are known and get those to a point where they're in a normal range, he will guarantee his patients they'll never have a heart attack under his care, or he'll give them all their money back.
Wow.
And so he believes so strongly that inflammation is the subject. So we're learning about the role of oral infection, meaning oral pathogens, effect on circulatory and GI health and disease. And Dr. Pritchard is teaching us about systemic inflammation and how to even look at blood work and the specific markers that you want to look at that relate to vascular inflammation, which we should know about whether we're
Absolutely.
treating it, we should know about it and whether it would be wise for someone to be tested for these things. So we talk a lot about salivary testing. We talk about airway and the importance of oxygen and how when airway is compromised and oxygen saturation levels drop, it causes tremendous inflammation all through the body and even affects oral health directly. And so we're looking at that along with other things like gastric reflux and so it's really been fun with that, and it's very doable to learn it. The second pillar is airway, breathing, and sleep disorders, which is so rampant and is a true pandemic. Not just sleep apnea, which is kind of the tip of the iceberg, but something that Dr. Christian Gimeno at Stanford University Medical Center and Sleep Center there described as upper airway resistance syndrome. And so you see that very often in children, young adults, and may often even mimic what we would call TMD issues, like a young, fit female waking up in the morning who's been clenching and grinding, has headaches in the morning, feels terrible. Dr. Gimeno would say, well, that's classic upper airway resistance syndrome. And we would say, well, that's TMD. And the answer is it's a blend, of these things that we need to look at and study on each person. So I can't be a good TMD doctor, which is something I've done my whole career and taught, unless I understand airway and breathing disorders, because that could be the key for somebody that I see, in fact, often is. So that's the second pillar. And the third pillar is TMD and dental malocclusions, which is uniquely a specialty of dentistry. So, we need to take on that role for those that have those disorders, which again can link to these other things. So I've tried to keep it simple: 3 columns, three pillars. That's all we're going to talk about. But if we can master our understanding of those 3 things, we can raise the bar so high in dentistry that I believe we can become the most highly respected profession in all of medicine, because unfortunately, Taryn, we don't have any competition. And it's been astounding to me to interact with specialists and see how narrow their view is of their work. And so, for example, you might have a sleep physician, and I don't want to generalize, but this is not uncommon. A sleep physician may say, we do polysomnograms and we administer CPAPs, and that's all we do. We're not really looking at other solutions. We're not really open to other discussions. And so if a patient doesn't want to go have a sleep study, we tried. If they don't want to wear a CPAP, we tried. And we know it can not only greatly compromise your health, but literally kill you.
Yeah.
But we're willing to let them walk. And it's just shouldn't be like that.
I think you bring up a great point in that dentists really have not given themselves enough credit. We've done a lot really well. I
Yes.
remember, I once had a conversation with an exercise physiologist who was
Yeah.
saying, how did you get your patients to brush their teeth not just once, but twice a day? I can't get my patients to stretch.
Yeah.
And those things that we take for granted, where dentistry has really made an incredible impact on the greater population's health. We
Yes.
really forget how powerful we are. We forget that one component that you mentioned. We get our patients to see us every 6 months,
Yeah.
and they stay with us for decades. That's
Yes.
something that not another doctor or healthcare provider has ever been able to do.
Yeah.
And we've maintained our autonomy in
Yeah.
the greater spectrum in terms of
Yeah.
insurance companies and regulation and things like that. So
Mhm.
I agree with you.
Yeah.
Dentistry is a very it's a word I'm looking for. We don't take ourselves seriously enough, and the potential that we actually do have as a profession.
Yeah. Yeah. I think that we feel that we are not as educated as we really are, but we've got as good a background as any physician in dentistry, coming out of school.
Yeah.
And then it just depends on what you want to learn. But we've got all the ability in the world. The second thing along with that is the loyalty relationship component.
Absolutely.
that we have. And so dentists will ask, well, can I talk to a patient about these things? Because they'll say, you're just a dentist. I've never had anybody question that.
Yeah.
And so, and especially if you're good at dentistry, if you're thorough and comprehensive and you know what you're doing, which we all should, then to bring up and say, we're learning there's links to other parts of health, which people already know intuitively or they've read it, that we want to really pay attention to because it's part of the big picture for us helping you. And patients are all ears. I just have never found that to be an issue at all. But I think we in dentistry sort of think of ourselves as stepchildren, to real doctors. And it isn't like that. I'll give you a quick example if it's okay. We're learning more and more about airway breathing and how, let's say, young children that have allergies and congestion nasally will convert to mouth breathing. And now you bypass the whole filtration system of the airway. It's just like the air conditioning filters in your house and how, it's necessary to use them, but they'll get sooty and dirty because of what's in the air. Well, if you bypass the nose and go right through the mouth in young children, you can get overwhelming inflammation of the tonsils. And so in medicine, they'll typically say, well, we don't really know why children's tonsils get enlarged, but they do, and they get infections as kids. And we give them rounds of antibiotics for their tonsillar infections, and we hope it goes away. And we don't really want to take them out, but if we have to, we could. But they really don't know why. It's just infection. At Stanford, where we have the top sleep research center in the whole world, they've concluded that it's primarily mouth breathing that's driving these tonsillar inflammation and infection issues. So now you've got a child who can't breathe through their nose and they can't breathe through their mouth well. And so they're tossing and turning, they're sleeping poorly, they wake up tired, and we call it ADHD.
It's
And
just the beginning. Oh my gosh.
Yeah.
I know. Well, I think this is where the mental health component is also within our realm. And I know that's not something that's a part of your 3 pillars, but so deeply implicated in every aspect. I mean, even when we just talk about inflammation, the amount of cortisol that stress pours over every single part of our body, and how we know from research that cortisol increases inflammation, and how we can turn a blind eye to such an important component. And going back to what you were talking about that obese patient who's walking into the sleep clinic when nobody's paying attention to the obesity or the need for better care of their nutritional needs. And then why they're eating so poorly. What are the mental components, the mental health components that are leading them there? And I think you're absolutely right. We're doing our patients a disservice to keep a narrow focus.
Yeah. Well, you're really on to something for sure. I really appreciate that. I'm excited to learn more about your work. But in the light of this whole thing I was talking about, tonsils, I was on the phone a year or two ago with a friend who lives in another state, and we're involved in sort of a national charitable thing. And so we had periodic calls, and one night I'm on the phone with him and I said, hey, how you doing? He says, great. And I said, what's new with you? And he said, I just retired. I said, oh, that's great. What do you do? He said, I'm a pediatric ENT surgeon. And I said, well, tell me about your work. He said, I take tonsils out. He said, I can't tell you how many I've taken out, thousands of tonsils. And I'm the head of the pediatric ENT residency program at the University of X. And so he'd had a very illustrious career. So as I'm listening to him, I'm getting excited because of, what we're learning. And I said, well, let me ask you, when you're talking about tonsils that are enlarged, swollen, and inflamed and infected, how much do you all focus on nasal versus mouth breathing? He didn't answer. There was just a silence. I said, that when you bypass the filtration, purification, sterilization of the nose, that you're breathing dirty air right into those poor secondary lymphoid tissue and they can't take it. And he said, I've never heard of that before.
Expert in tonsillectomies.
I wasn't happy. I was embarrassed because it was like, wait a second. how come I'm on the sidelines and I know about this? And this is your area of special focus for 40 years. And I explained it a little further from what I've read and heard and learned from Stanford. And he said, that is so fascinating. Would you consider coming and talking to my residents sometime? He said, in all the meetings I've been to in 40 years, I've never heard that mentioned. So it's like we're in our lane, but we're not really trying to think outside of the box. We just have our protocols that we learn in medical school or dental school, and then that's what we do for the next 40 years. And so I've learned to not feel in any way intimidated, respectful, of course, but not intimidated, because some of these things that we're learning and the importance of oral health too for whole body health, which makes total sense, that
Absolutely.
Through the mouth would come many issues that would be very important for the rest of the body. And somebody needs to be looking at that. I had another patient come in, a young lady who was referred by a dentist for TMD. So I've been seeing TMD referrals for my whole career. And so this young lady comes in 21. And I said, well, what's going on? She said, well, I'm having sore muscles and I'm clenching and grinding. I'm waking up in the morning. I'm fatigued all day and I'm having headaches in the morning. And she said, and last week, I woke up in the middle of the night and my heart was racing and my chest was pounding so much I thought I was dying. So I went to the emergency room at 2 a.m, 21 years
21.
old, 21, and fit. She's, petite and normal size. And she said the the emergency room physician did an EKG and, some labs. All of them came back negative. And he said, I think you were just having a panic attack in your sleep. And therefore he gave a prescription for anti-anxiety. So as you're listening to this, you're thinking, what could cause, if we're going to ask why until we can't ask why anymore about why something would happen, what could cause you to wake up in the middle of the night and you can't breathe and you're panicked and you're huffing and puffing? The first thing you think of is, well, maybe you're not breathing,
Can't
maybe
breathe.
your
You're
body's
suffocating.
there's a fight or flight going on saying you're choking to death here and you better wake up or you're not going to survive. That would be kind of one of the first 2 or 3 things, at least, that you'd have to think about. So I simply said, I want you to open your mouth and raise your tongue up as high as you can. So she opens her mouth up 40 millimeters and she raises her tongue up about 5.
I could have guessed that. Mm-hmm.
Right. And then when you look in her mouth, not only does she have severe tongue tie, she also, her uvula was hidden down the back behind her tongue. So she was a so-called Mallampati 4, which has about a 90% correlation with a significant airway problem. She had a very scalloped tongue and narrow arches, which has about a 70% correlation with a significant airway issue. Her upper arch was sort of V-shaped and very narrow, which meant her tongue never goes up there, which meant she's almost certainly a mouth breather, which is dysfunctional breathing. And so I asked her about allergies, and she's had allergies her whole life, and she knows she's a mouth breather. And then the other thing I noticed was that on her incisors, well, it's actually 6, 7, 8, canine lateral central, but top and bottom, she had wear facets that were all the way through the enamel at 21. So she'd gone out here edge to edge, kind of right anteriorly, and even in the crossover, and that was where she liked to brux. And the question would be, now I know that's not occlusion. That's not poor anterior guidance or posterior interferences or any of the other things that we talk about in occlusion. Why would somebody do that? And the best explanation I have is because they're doing CPR.
They can't breathe.
To get their jaw out of the way, their tongue out of the way of obstructing their airway. So I saw 5 things just by saying, open your mouth and raise your tongue, that said, this gal's got a significant airway problem. We sent her home for an overnight home sleep test that night. It came back, her AHI, which, as you know, 30 is severe, was like 35, I think. So she had severe sleep apnea, no one would ever guess because she wasn't a fat old man. The stereotype, even medically, that we would stereotype that in the medical field. And she had severe sleep apnea and upper airway resistance and lots of inflammation everywhere. It was just a screening was. So I'm thinking now, okay, I'm a dentist. I'm just doing my thing in the mouth. And you're going to an emergency room where you should have the top diagnostic physicians working. And it took us, and I'm not talking about me, obviously, but it took 2 minutes to figure out what was going on. And in several hours of testing, et cetera, they came up with nothing. So again, we have the opportunity to be the top, I'll call it primary, care providers in all of medicine with no competition. So that's my vision for the next frontier in dentistry, is that we can do that, but not just dentistry, but in collaboration. So, as I've been pursuing this over the last 10 or 11 years now, I have ENTs and pulmonologists and sleep physicians that are sending me patients because they understand there is an oral component, to this, and they will include us sometimes on cases that they're trying to figure out. So you not only can gain respect in the community in general, but even in the medical community.
Absolutely.
Well, so that I'm proclaiming that's the next frontier.
I love it. I love it.
And it makes sense,
It does make sense, and it's perfect timing too. And what I would love to know, because I think you are absolutely onto something huge and possible. And I think what you mentioned in your story was the trepidation that many dentists have. Who am I? Right? Who am I? You mentioned being a little bit fearful of having to learn all of medicine. And so you recognize, I need to simplify this.
Yeah.
There must have been a time for you where you went through that questioning as well for yourself, where you were sitting here in this beautiful Dawson Academy, impacting 40,000 dentists and their careers, and deciding to make this turn in your attention, where you had a question of, who am I to be thinking about this? Look at all the good that I'm already doing in this world. I'm making such a great impact. And who am I to dream even bigger? And I'd love to know about that moment in time.
Okay. There's a book right here I'm going to get. There's a bookshelf right here in the Academy, and the book's been pulled down. Somebody must be looking at it. But
okay.
I'll tell you Dr. Dawson's story. And so many have been impacted by him, but probably the two most impactful dentists in the last 75 years have been Dr. L.D. Pankey and Dr. Pete Dawson. And they're the old school of giving back and, always providing much more than they would ever take. And so in 2018, someone spoke with a biographer who'd done another number of biographies on prominent people in the United States, and sent them to Pete Dawson and said, you should write a book about this guy. And he asked, what does he do? And they said, dentistry. And they went, wow, that sounds exciting.
I'm sure.
But they said, oh, no, there's much more to it. Anyway, the story goes that this biographer calls Dr. Dawson and says, I'd like to write a biography about your story and your life and your career, because I hear you've impacted so many people. And Dr. Dawson, as I would expect, his first response was, oh, no, I would never want to do that because it would sound self-serving. And so the biographer was adept enough to say, oh, that's fine. Well, let me ask you one other question before we hang up. Do you feel like there's been a key to your success and your influence? Has there been a key to that? And Dr. Dawson immediately said, of course. And he said, well, what would that be? And Pete said, when I first started out in practice as a young dentist, I vowed that I would always ask myself this question every day. And the question is this: is there a better way? And if the answer is yes, then that's what I need to do. And so the biographer said, well, that sounds like it would be important for others. And Dr. Dawson said, it's the key to everything. And he said, well, how about if we write a book together, and it's not about you, but it's about what you've learned, and we'll call it a better way. And you can share this with other people that could benefit from it. And Dr. Dawson got real excited and agreed to do it. And they ended up writing essentially his biography called A Better Way. Now, I tell you that because you asked me a question, and the answer goes back to the first day I ever practiced, because that was what Dr. Dawson taught me. If you're going to be here and you're going to work, under my guidance and mentorship, and you're going to be part of this practice, you have to commit today to always trying to find a better way. Because if that's not what you're about, then this isn't the place for you. And so when it came time to explore this avenue, to me, it was just what we had to do. And it was the right thing to do. And I just began to seek out the people that did have expertise in all these areas to ask them if they would teach me and help me learn it, first for my patients and truthfully, even for my own health, and then my patients and family, and then, whatever may come down the road with education. But so it's just like everything else, Taryn. I would never see myself as a public speaker because I'm shy. But if you're passionate about something, you can overcome it. And I think when you catch a vision, and you've done that so well, when you catch a vision for something that is essential, for your happiness or your fulfillment or your meaning in life, then you can pursue it with an energy that goes beyond your comfort zone. And so I would say that's kind of how it's worked for me. I've always also been interested that everywhere I've ever been, if you find people that have expertise in something and you go ask them for help, they love it.
Absolutely.
They are passionate about what they do, and they would love to mentor anyone who'll come to them and say, "Can you help me?" They'll absolutely say yes. So that's always been my experience. So that's, I guess, sort of the answer that I would give to that, is that it's just part of the process of, trying to be the best you can be.
I'm thinking about that general dentist, or perhaps a specialist, who's listening to this podcast.
Yeah.
And who is every story that you're telling about that young child, or that 21-year-old, or
Yeah.
that older gentleman, recognizing in their patients. Because I think another thing that is very unique to dentists is we're lifelong learners, for sure.
Yeah.
And we're constantly curious and asking questions. I think that's something that's integral in dentistry, right? Constantly thinking of new ways and how can I be better? I think that's something we all share in common.
Yes.
So that dentist who's listening to this podcast and who's saying, yes, I agree, there's such a bigger component to dental health in the greater systemic health. And I want to be a part of this. And there's a part of me that's saying, oh, I'm just a dentist in a small town in the middle of nowhere. Speaking to that dentist who's getting that spark, who's maybe having that awareness as you did in that room that one day when it hit you like a ton of bricks.
Yeah.
Speaking to that dentist, what would you say to combat that fear of not being good enough, that wanting to make a difference, realizing the need for this, because I believe every single one of us wants to leave this world a better place than it started. But the fear of not being good enough or not being qualified enough, what would you say to that person?
So I don't know if you've read the book Outliers. Anybody who's having that concern, I would highly recommend that book.
Great suggestion. Yes.
Yeah, because it's all about those people who are exceptional and are beyond normal. And the thing that you find is it wasn't because they were born a genius.
Nope.
Wasn't because they were just much more talented than everybody else. It had a lot to do with commitment, vision, support of other people, and putting in the hard work. And so I have been shocked in my lifetime coming out of a town where the high school I went to, it was very below average. And I didn't know if I was a good student or not, because it was so easy, for everybody, that I had to learn, that I could learn anything that I wanted to if I would put in the work. And And I've just been shocked to see through the years, how far this has taken me, and certainly inspired and supported by people like Dr. Dawson, but many, many others that nobody knows, from a national standpoint, just friends and family and people in the community and church, and that have mentored as I've asked for help. But then also being willing to put in the work. You heard me say that when I decided to learn about this, I started going to meetings, where it was out of the box for me. I'm the only one in the room that doesn't already know so much. And so I'm having to learn from scratch. But you can. And there's so much information today, it's beyond belief. I mean, you can learn in 10 minutes on the internet, what we used to have to drive to the university and go to the medical library and look up microfiche and download articles on the Xerox machine, and then bring it home and read it and figure out if there was anything good there.
Now it's in your pocket.
Now you just look up what's the connection between, what research has there been, and in 5 minutes you can write your own book. And so that is a huge advantage today. But I would just say you can do whatever you want to do, and there's no limits to that except the limits that we put on ourselves. And we all have unlimited potential. There's no doubt in my mind. Anybody that's listening to this podcast can do anything that they want to do if they really, are excited about it. And the process is fun too. It isn't just work. I mean, you're every day learning new things that create new insights and start putting the pieces of the puzzle together.
Yeah.
So I would say just that commitment, and then seeking out, the information. I wrote a book I didn't mention to you in 2019. It's called The Shift, which means the paradigm shift, the dramatic movement toward health-centered dentistry. And that's on Amazon. And that really was written to be an introduction to all this. It covers the 3 pillars that I talked about, a lot about inflammation. I try to back it up with the research that I've found and done and others have done, and examples with patients and things like that, and applications. So that's a super easy. There's a little bit of summer left to read a book. I need to do it on audio because I realize a lot of the young learners aren't really readers, but it's an easy read, and it's written for the public as well as for professionals. But that would be something I would recommend, simply because it was designed to be an introduction to say, if you don't understand what we're talking about, check this out, and you'll really get a good understanding of the foundations of all of this.
Brilliant.
Yeah. And then AOSH, I mentioned, the American Academy for Oral Systemic Health. They meet every year in September for 2.5 days. And this year they're in Orlando at Disney in September. I think it's the 3rd week of September, but they have a website. And then, as I mentioned, we've started this Integrative Dental Medicine Scholar Society, the Scholar Society, in which we're doing courses, a lot of online things. One of my objectives at this point in my life, Taryn, is this isn't my retirement plan. I hopefully have that in place. This is more, how can I give back? And so I'm very conscious of the young hygienist that's paying her own way for education, the young dentist who can't really leave the office and get on an airplane and go stay in a hotel and pay registrations for meetings and things like that. So we're creating as much as we can online learning, as reasonably as we can, cost-wise, and helping people learn these things that we've learned and be able to begin implementing them. And then, we'll also have some live type workshops for those that want to pursue more. But that would be another avenue, as you can see what we're doing at IDM Scholar Society. But those things, AOSH, IDM Scholar Society, those would be the book, The Shift. Those would be, beginning learning opportunities. And then there's other groups that focus on just airway or these sorts of things that, also are excellent. And I'd be happy to share recommendations with anybody that's looking for, certain course or certain this or that. I'm very fortunate that our field is so small that most of the people that are doing significant work I know really well. So if you wanted to learn how to do tongue tie release surgery, I can send you to the person that can teach you that. Or if you want to learn how to look at children's airway problems and arch expansion and this sort of thing, I can send you to them. So I can give you my email address if you don't have it. I think you do, Taryn, if you would post it. But anyone listening that would like to, ask me a question or looking for something, if I can be helpful, that's why I'm here. And so I'd be more than happy to
Well,
help.
we'll definitely put in the show notes the links to definitely to the IDM Scholar Society, to
Okay.
AOSH, and then also to your book.
Yeah.
And if people wanted to reach out to you, how
Yeah.
could they reach you, Witt?
They can reach me at my personal email that you have,
Sure.
wittwilkersondmd@gmail.
Wonderful. Thank you so much. And, let me just, before I ask you our final question, I could talk to you all day, and we really have talked a long
Yeah,
time
I'm
here.
doing too much talking. I love to listen to you more.
It's so exciting what you're talking about. But I just want to commend you. The number one, I want to say, first of all, thank you to that incredible mom of yours.
Yeah.
What an amazing woman and what a phenomenal um really role model for you. What an incredible story. Thank you for sharing. And then thank you for taking up the call and for having the courage to say, you know what, this is so important.
Mhm,
And I'm going to make a left turn here, even at the height
mhm,
of my success in my career, and
mhm.
really give back, as you had mentioned. And thank you for having the courage to do so and really bring this to the forefront. So, and thank you for making this opportunity available to so many men and women who I know are feeling and knowing the same depth of our potential in the
Yeah.
medical field. So thank you very much.
Well, I want to learn more from you, Taryn, and we've had a brief
Yes,
conversation about that, but we're going to try to get you uh, down here to Florida and hear more about what
absolutely.
you're
I'd be honored.
an expert at and are sharing with so many others. And
Yeah.
so we'll follow up on that
We'll
together.
definitely do that.
Yeah,
Before we leave here today, I have to ask you the question that I ask of every single one of my guests.
sure.
What is your definition of happiness?
Oh, that's good. Okay, so you have to know where I'm coming from. I'm coming from the position as someone whose faith is central to their life and heart. And so I've devoted myself to what I believe are the principles of our Judeo Christian heritage. And that is that the primary principle of all scripture is love the Lord your God with all of your heart, mind, and strength, and love your neighbor, that is everyone else, as you've been loved or as yourself, which isn't really focused on yourself, but it's I've been loved so much by God and it overflows into my service to others. And so that really is my happiness and my significance and my joy, which, kind of surpasses circumstances. So if you believe, which I believe with all my heart, that God loves me and has a wonderful plan for my life, then whatever I'm encountering right now, I know is part of the plan, and I know the plan is good and it's in my best interest. But that also motivates us to think about other people,
Mhm.
and even how good things come out of bad. I've seen so many times when I've grieved and gone through painful things, and it's given me the ability to relate to somebody else who now is grieving and relate to them, not because I know exactly what they're experiencing, but because you've had something parallel in your own life, and you know what to say and what not to say, even if it's just to say I love you. I'm not going to try to
Mhm.
explain it. I'm just going to tell you that I love you and I'm here for you. I can't tell you why this is happening or you know the end of the story, but I hope someday you'll be able to look back. And the greatest thing, for example, that ever happened in my life, Taryn, was when I was 17, my father contracted leukemia.
Mm,
And at the end of my senior year of high school, about a month before I graduated, he passed away.
mm,
And he was my hero. And I just felt like an orphan. But in my spirit, I felt God saying to me, so now what are you going to do? Are you going to spend the rest of your life upset and running away from me? Or are you going to run to me? And in my heart, I felt this answer, which was, I don't have anywhere to run. I'm an orphan, I feel like. And so I guess I'll run to you. And in my heart, I felt God say, good, I'll take really good care of you. And
Mm.
that was 50 years ago. And there isn't a day that's passed that I don't feel that and sense that he's there with me and has a purpose for my life. And it's to humbly serve other people and try to enrich the lives of others and love them as I've been loved, and without judgment, without any conditions, just do it. And so I feel a great sense of freedom in that, and it brings me great joy and happiness. So I have to say that's the kind of the behind the scenes of everything since you asked.
I love it. I love it. Well, thank you. Thank you so
Thank
much, and thank you for everything that you do bring to this world. You're a
oh,
gift.
thank you, Taryn. You are too. Thank you
Thank
so
you.
much.
And thank you to all of you for joining us here today. And be sure to check out those links in the show notes and to reach out. Witt means it. I know personally that he means it when he says you can contact him. And remember, when you feel good, that's when you can do good. Bye bye.
Bye bye.